We have spoken about this quite regularly in the past few months, and you had also suggested that it may well be a stretch to have everyone vaccinated by October. So does this admission from Murphy yesterday come as much of a surprise to you?
Look, I think we have to separate the sort of political announcements, and it's been quite bemusing to see what's happening over the last few days because there's been a fair bit of gnashing of teeth over this. But really, if you look at it from our point of view, which is the Australian Medical Association, we're looking at it from just a health point of view. We definitely view these as targets on a massive operation. And you've got to remember, a lot of these targets were set up when there was still uncertainty about various things, like when the vaccines were going to be approved, when the supply was going to happen. And as you can see, there are supply issues at the moment. But also, things have changed in terms of the guidelines. And one of the key ones which has been mentioned is that the AstraZeneca vaccine, the separation between the first and second shots has gone from 1 month to 3 months, which automatically pushes things out further. So when you add those things out, I'm not surprised that, we really are looking at a stretching of that. Having said that, I don't think people should view this as an undermining of the overall plan, because it has actually helped the planning, I know, behind the scenes, and also given some guardrails about the decision making. But also, I don't think it'll affect things materially. I mean, that's the thing. By the time we get to October, the vast majority of people are at least going to have that first shot. We know once you've had the first shot, you're pretty much protected. And whether we're talking about whether they're going to, the vast majority are protected or not by that stage, I don't think it really is a lot of difference.
Well, I was going to ask you that. I mean, Murphy talked about this yesterday, about that one shot. Is it good enough? Is one shot good enough, in your opinion?
They've pretty much shown that once you've had the first shot, whichever vaccine you've had, within about a month of that, you've got 90, 80, 90% protection at least from ending up in hospital and getting serious disease. So really, that's really what we're after. Yeah. And that's the whole goal. So really, materially, I know what's gone on yesterday, but really from the medical point of view, we've got the eye of the prize is really the big push on when the AstraZeneca gets manufactured in late this month, and really getting out to far more points of vaccination, which is where the real push on is going to happen.
Well, I guess a lot of the negativity comes from an economic point of view, though, Doctor. I mean, if there is, say, an outbreak, and it could well happen at any time, then borders are going to have to be shut down, and then criticism is going to come for the government by saying that, well, we should have done this faster. If this had have happened faster, then maybe we wouldn't need to shut things down.
Well, I think the critical thing is we get as many people having their first shots as possible, and particularly the high risk people, which is why I think I think so far, even now, we're behind, I think, 120,000 people have been vaccinated. But again, they're the critical ones that we've covered: the frontline quarantine workers, frontline staff, and aged care residents. But in terms of the next real push on, that is the key bit, because we have to get it out into the community, get that the next lot of people who are higher risk, the older population, and also the population with significant conditions having that first shot. And again, once we get that, suddenly you can even see overseas, once you get into those, 15-20% sort of vaccination rates, which has happened in the UK, really the risk starts really dropping. So again, materially, I don't want to sound like, an apologist for, political promises that haven't quite been met. What I'm saying is, materially, we've got from a medical point of view, the eye on the prize is actually doing something which is massive and important for the Australian community.
Yeah. Okay, and just finally, Doctor, GPs, some criticism has come from GPs saying that they just don't have the capacity to be able to vaccinate people in those limited hours that they have every day. Is that fair enough?
It may not be for everybody, but, a large number of practices, and it's shown the level of goodwill out there from general practice who understand their importance in this, to get out there and do it. 4,600 first off the bat in the next month or so are going to come online, and they understand that their patients are relying on them, and they have a lot of trust there to get this done. And that's look, we'll have to see whether the support is enough. We'd always want more, and it'd be great to have that extra support, and we'll be working with the government with that. But ultimately, I think what you have to understand from the point of view of the majority of doctors out there, they just see how important the importance in this, and that really the community's crying out for this, and doctors are ready to get out there and just do it.
All right, Dr. Chris Moy, always good to chat. Thanks for your time this morning. We'll talk to you soon.
It's a pleasure.